your health in your hands. I'm Dr. David Ajibade with the Brain and Body Foundation. As part of our mandate, we are to provide you with information and education, not just for the lay people, but for healthcare professionals as well. Part of our mandate is actually to teach in healthcare in training schools for doctors, pharmacists, nurses, as well as for the public, because there's still a lot of education that we really feel needs to be gotten out. And we've been privileged to have partners and friends and people in the US and other parts of the world who are willing to share their information, share their research findings, share their discoveries with us. And we are passing it on to you. And of course, one of them is someone I've come to respect a great deal, Professor Fowler, actually, of the Virginia Commonwealth University. And if you were on last week, you remember he was talking about the fascinating study into how vitamin C can work effectively in the treatment. Remember, I used the word treatment of ARDS, which is Acute Respiratory Distress Syndrome as a result of sepsis. Now, what you say, what does that have to do with COVID-19? Well, it has a lot to do with COVID-19. It's because COVID-19 primarily affects the lungs. And as Dr. Fowler said last week, the findings in the lungs are very similar to the findings as a result of sepsis, which is when there's infection all over the body and it's causing organ failure. So it's almost like a reverse of what happens with COVID-19. In COVID-19, the virus attacks the lungs, and from the lungs, there's sepsis and there's all kinds of damage to the rest of the body. And what Dr. Fowler is talking about is there's sepsis around the body, there's infection, there's damage to the organs, which includes the lungs. But the process is still the same. Bottom line is that vitamin C can play a significant role in the treatment of lung disease and therefore can save lives, which is what everyone is after. It's the saving of lives in the simplest, safest possible way. So, Dr. Fowler, thank you again for taking the time.
Glad to. Okay, and as you know, when we were speaking last week, we showed this slide, which was meant to show how we enrolled patients into the study. 83 patients who were placebo standard of care patients, and 84 patients who received vitamin C and also standard of care. And our dosing scheme is listed here, which means that an adult in an intensive care unit would receive about 3,500 milligrams intravenously every 6 hours for 96 hours. Here is the effect on plasma. And what we see here, this is baseline. And when vitamin C was infused, we could achieve very high levels that were about 1,000 times higher than the normal plasma level. But the important thing about sepsis, you see this orange dotted line, the important thing about bacterial sepsis as well as COVID sepsis is that baseline vitamin C levels are low, and these are critically low vitamin C levels. And you can see the effect of our infusion over a 4-day period. And then even at 168 hours, which was day 7, we still were able to achieve levels of vitamin C that were above that in the placebo patients.
Just a quick one, Doc. So if we may go back to that slide, just for our uninitiated viewers, baseline for vitamin C would be what?
70 micromolar in the circulation. And okay, you see the dotted line, this is 20 micromolar. And so these levels are seriously low. They're at the level of what you would call scurvy.
Interesting. And that's as a result of the sepsis. So it does make sense to take care of that, to replete that, even if it doesn't go as high as this. So basically, if I may just jump in here, if anybody's going through any kind of sepsis and who may not have access to vitamin C infusion, is there the possibility, and I don't want to put you on the spot here, of them, would you advise them to take vitamin C powder if they're in some kind of respiratory distress problems?
That's a great question. And the answer to that is it's been very carefully studied. you cannot take enough vitamin C through your GI tract to achieve levels like I'm showing here.
Okay.
It has to be given intravenously. Now, having said that, if you have a high diet concentration, like taking medications orally of vitamin C, you can achieve a plasma level of about 120 micromolar, which is about 2 times normal, but nothing like what I'm showing here.
Okay.
And so, as I mentioned, we used the Sequential Organ Failure Assessment Score, which measures 6 different organs: brain, it measures the extent of respiratory failure, liver function failure, bone marrow failure, renal failure, and shock. The one thing about our study, the clinicians that were involved in the study did not draw enough hepatic function studies for us to make sense of vitamin C's effect on the liver. So we called it the modified sequential organ failure assessment score. All of our other organs were analyzed.
And these are all organs that are affected in COVID-19, yes?
Exactly, just as in bacterial sepsis.
Okay.
When we performed our initial analysis of the organ failure score, we did not account for the people who had died and had analyzed their organ failure. And so what we reported initially was a survivorship bias, because we only analyzed the organ failure scores in the people who had survived, which was wrong. And in the aftermath of publishing the JAMA publication, we received a ton of letters telling us we had analyzed it wrong. And I'll show you the reanalysis in a couple of slides. We analyzed C-reactive protein, which we did not find a difference. We analyzed the protein thrombomodulin, which we didn't find made a difference. But in the aftermath of this, we analyzed 2 additional features of the inflammatory response. If you remember how I mentioned NETs, neutrophil extracellular trap formation, when that happens, it releases a lot of DNA into the circulation, free DNA. And we analyzed the free DNA and found that vitamin C dramatically lowered the free DNA. And free DNA has been studied over the years, and the higher your free DNA level, the higher the chance you're going to die in bacterial sepsis. And we showed that vitamin C dramatically reduced the free DNA level. And another protein called syndican-1, which is a protein that lines the surface of the blood vessels, and it breaks up and is released into the circulation in high numbers when you're septic. And we showed vitamin C also reduced that level as well.
Interesting. Folks, we're going to take a quick break here. Don't go away. All right, we're back with Dr. Fowler and his study on vitamin C and sepsis. Please go ahead, Doc. Okay.
So as I'd mentioned last week, we were looking at ventilator-free days, which was how quick could a patient get off being on the ventilator when they were treated with vitamin C. And what you see here on the left is the vitamin C patients. And there was a strong trend towards getting people off the ventilator earlier, but you can see up here, it didn't quite reach statistical significance.
Okay.
Importantly, however, we showed that vitamin C would make patients get better to the fact that they could get out of the ICU earlier. And we looked at intensive care unit free days over the 28-day period and found patients treated with vitamin C got out of the ICU faster. And in the United States, the average day in the intensive care unit is about $40,000. And so by getting people out of ICU earlier, it also helped with cost of medical care.
Interesting. Doc, quick one. What's your impression? What do you want to say a few things about ventilator use and ARDS, or whether in COVID-19 or sepsis?
It's complicated, highly technical. Ventilating people in acute respiratory failure, either with sepsis-induced acute respiratory failure or now COVID-induced respiratory failure, it's very complicated. It can extend out to sometimes as long as 2 or 3 weeks. And so if we apply vitamin C in a way that I'm listing here, we may be able to get people off mechanical ventilation earlier simply by reducing the inflammation in the lung.
So the key is inflammation.
Inflammation in the lung.
So just in case, it's especially again in third world countries like ours, where the ventilators aren't as available, there may be a case for healthcare professionals using IV vitamin C to help to reduce the inflammation, because ventilators aren't going to be able to do that, right? Ventilators
And whether it's what we call invasive mechanical ventilation, where you actually put an airway tube in, or whether you're doing face mask ventilation in somebody who's marginal and it can receive face mask ventilation, you want to get them off mechanical ventilation as quickly as possible.
Okay. That says a lot of things, Doc, but I'm not going to press you on that.
All right. So what you see here, we showed that vitamin C significantly increased the number of hospital-free days out to day 60, which is very important.
Yeah, for financial reasons as well as for health reasons.
So what I'm showing you here is the effect of vitamin C. This is a survival curve. And what you see here, I'd like to, first of all, look at this orange column. And the blue are the placebo patients. And this is mortality. Look how fast the untreated patients were dying in the first 4 days compared to vitamin C.
Wow, wow, wow.
19 patients died in the placebo group versus only 4 patients who died in the vitamin C treatment group. This is what is called a Kaplan-Meier survival curve. And you can see that once patients come off of vitamin C, there's kind of a similar trajectory in these lines. But by the end of day 28, we found that the placebo mortality was 46% versus the placebo mortality in the vitamin C patients of 30%. And this was highly significant.
Definitely. Wow. Wow. So the treatment period was only 4 days, just to recap. Only 4 days.
4 days, 96 hours.
And after that, they were left to themselves.
Right.
Regular treatment.
Exactly.
Okay.
And so I wanted to show this in that after we published in JAMA, we received a number of letters telling us that we had applied the wrong analysis on the organ failure scores. And so what we had reported was a survivorship bias. But when we included the organ failure of the people who died, look at the effect of vitamin C on organ failure. It was highly significant at p less than 0.026. So vitamin C not only saved lives, but it also, in the people who made it through this course, it improved organ failure significantly.
So the lower the score, the better the...
Exactly. The lower the score, the better.
Fantastic. Fantastic.
So I'll stop here by saying this, because I think this is what you really wanted to talk about. High dose intravenous vitamin C is extremely safe in people who are critically ill. It does not reduce the blood pressure. If anything, it improves blood pressure, because as you give high dose vitamin C, it helps the body to synthesize the hormone that helps control the blood pressure called norepinephrine. We found that when we had reported on survivors, there was no difference. But when we reported on non-survivors, the organ failure score was significantly lowered by vitamin C. We found significant treatment effects on ICU-free days. That's important. Hospital-free days. That's important. And this is the wishing well that has been worked at for 50 years. What can we do to save lives? And we showed that a simple concoction would bring down the 28-day mortality. And when we adjusted for mortality, we also showed vitamin C improved organ failure.
That is significant.
It's important for me to show this last slide in that this was an example of team science, because you see the team here listed in front of you: physicians, critical care nurses, hospital administrators that let us proceed in these different medical centers, support from the National Institutes of Health, support from a large clinical research center on the VCU campus.
Folks, this is revolutionary. And I think this is so important for this to be shared. Again, not just with your friends and family, but also with your healthcare professionals. And those of you who know people in government and other governments in Africa, you need to share this video. This is really, really important, and it can save a lot of lives. And I remember when I was watching, I first came across the Dr. Fowler's video on YouTube. I was going for a walk in Abuja, the Jabi Park, and of course with kids, everybody running by and so much noise and all that. But when he started saying the things he was saying, I remember stopping dead in my tracks and looking at his slides and thinking to myself, how can this man be saying all this and still be employed in a very fantastic institution? Because I know of other people who had mentioned some things about vitamin C and they had been ostracized. But here he was showing hardcore data and showing that vitamin C could treat a disease that currently has, what's the failure rate, Doc? The failure rates.
Well, if you just look at the figures from our trial, patients who were treated with standard of care who had sepsis and ARDS had a 47% chance of dying.
That's almost 50%. Once they get into
almost half the patients died.
And now we're seeing the possibility of what's the rates now? The possibility.
Well, we've dropped it to 28. Well, actually, it was 28.8%, but I just reported it as 30. But I think the thing that I would emphasize to your viewers is this trial was conducted in some of the United States' best intensive care units. The Cleveland Clinic, Virginia Commonwealth University, Medical College of Wisconsin, University of Kentucky, Emory University, Atlanta. These are all institutions that have highly technical support and learning for supporting people with not only with organ failure, but respiratory failure, and are prepared to support them for as long as it takes.
Right. So point taken is that this is not in any run-of-the-mill kind of healthcare center.
Exactly.
Okay. But still, the point still is that there is some possibility of survival if vitamin C is added to the regimen, whatever it may be.
Yes, to a regimen of good ventilator care, to antibiotic care. In the case of COVID, probably remdesivir being used when it can be obtained. There are small trials that are going on with different monoclonal antibodies to various structures on the virus. But the thing about vitamin C, it can be deployed easily without worrying about any side effect.
That is huge. That's absolutely important. All right, thank you. And by the way, we're getting the head of the project, the remdesivir project, from Gilead Pharmaceuticals.
That's good.
you'll be on to do a presentation. She was like, we actually went to medical school together. So,
Oh, excellent.
yes. So looking forward to that. Thank you so much again, Dr. Fowler.
I'm so glad to be with you.
I really appreciate it. Any final words? Final?
My final words are, I'm so broken up about all the death that this pandemic has caused. In the United States, we're close to 500,000 people have died.
Mhm.
I personally have had patients who have died. I have had relatives who have died. My wife and I have two girls, and they're almost 40 years old. And in the younger years, when we were participating in travel soccer for the girls, we got to be friends with some of the parents that were standing on the sidelines with us. And we know that two of those parents that we knew for those years have died from COVID pneumonia.
Oh, no.
So hopefully your viewers can begin to think about incorporating vitamin C in their treatment regimens. McGuff Pharmaceuticals in Santa Ana, California is easy to contact. And as I had mentioned earlier, they ship vitamin C globally. And give it a try. There's nothing to lose.
Well said, Doc. Thank you so much again. Well, folks, please remember, these videos are available on our site and on the NTA site as well. So please, Nigerian Television Authority, I should say, but please access them and share them with others. God bless you, stay safe, and see you again next week.